Are you struggling to walk because of painful bunions? Maybe you've been told surgery is your only option, or you're worried your favorite shoes will never fit again. After extensive research into this topic, we discovered some encouraging news. There are proven ways to manage bunion pain and slow their progression without surgery. And today, we're going to share exactly what we found. We've analyzed data from the Cleveland Clinic, Mayo Clinic, and recent medical studies. The research shows something fascinating. While bunions affect about 23% of adults aged 18 to 65 and over 35% of seniors, many people have found effective ways to manage their condition without surgical intervention. And while research shows bunions can't be completely reversed without surgery, there are several proven methods to reduce pain and prevent them from getting worse. Today, we'll share 5 research-backed methods that thousands of people are using to reduce bunion pain naturally, walk more comfortably, prevent bunions from getting worse, and the best part? You can start trying these methods today. Let's dive in. Please remember, this is for educational purposes only. This is not professional advice. Method number 1. The right shoes make all the difference. According to the Cleveland Clinic study, footwear choices play a crucial role in bunion management. Their research shows that wearing shoes with heels under 1 inch high can significantly reduce bunion progression. Here's what experts recommend: wide toe boxes that let your toes spread naturally, soft, flexible materials, low heels, under 1 inch. Method number 2. Simple pain relief techniques. Medical news. Today reports these proven pain management strategies: applying ice for 15 minutes after being on your feet, taking warm foot baths with Epsom salts, placing gel pads over your bunion to reduce pressure. Method number 3, research-backed exercises. Studies from foot and ankle specialty centers have identified specific exercises that help. Toe spreads, spread your toes apart. Hold for 5 seconds, repeat 10 times. Towel grabs. Place a small towel on the floor and use your toes to scrunch it toward you. Method number 4, supportive solutions. The Foot and Ankle Center's research shows that consistent compression and proper support can significantly reduce bunion symptoms. There are several affordable devices that can help: night splints that gently align your toe while you sleep, toe spacers that help maintain proper alignment, custom orthotics or arch supports to improve foot alignment. Many people report finding relief using compression sleeves at night, particularly those made with newer bamboo materials that offer gentle, consistent pressure without feeling too restrictive. These work best when used consistently, so make them part of your daily routine. Method number 5. When to seek professional help. Research suggests early intervention can prevent bunions from getting worse. Consider getting properly fitted for shoes by a specialist, consulting with healthcare providers about custom orthotics, learning specific exercises from qualified professionals. While research confirms that bunions can't be completely reversed without surgery, studies show you can significantly reduce pain and prevent progression with these methods. Many people have found relief by starting with comfortable shoes and daily exercises, then gradually incorporating other techniques we've discussed. If you found this research helpful, please give this video a thumbs up and subscribe to our channel for more evidence-based health information. Share in the comments which of these methods you're planning to try. We'd love to hear about your experience. See you in the next video. Medical disclaimer. This article is for informational purposes only. Always consult your healthcare provider for medical advice. This is not professional advice.